Well, people who rely on Northern Light Health for their health care and Anthem for their insurance will soon be caught in the middle of an impasse between the two.
Northern Light has pulled out of contract talks with the insurer, and if things stay the way they are, more than 30,000 Mainers will soon find themselves out of network. Here's News Center Maine's Christian Harsa.
Contract negotiations between Northern Light Health and Anthem Insurance stalled. The two parties at odds over how active those talks have been.
At this point, Anthem Blue Cross and Blue Shield has not responded to our proposal. When following up last week, they indicated that they didn't intend to respond.
It's absolutely untrue for them to suggest that we have stated that we are unwilling to continue to discuss and meet.
The two companies were negotiating new reimbursement rates. President of Anthem in Maine, Denise McDonough, says Northern Light asked for an increase of 10% every year for 3 years, which Northern Light denies.
Yeah, the proposal we gave them had a modest rate increase, certainly less than the 10%.
Northern Light Chief Financial Officer James Rohrbaugh says the hospital system wants a higher rate of reimbursement, alleging Anthem has denied and delayed payments. McDonough says Northern Light is paid as fast as anyone else.
91% of our claims are paid in 15 days.
If no agreement is reached, physicians at Northern Light will become out of network starting October 1st, and all Northern Light non-emergency care will be out of network January 1st. McDonough says Anthem is working with other hospital systems to find primary care options for patients in northern and southern Maine.
We have a number of providers in both of those regions that have capacity to take on primary care patients.
Rohrbaugh says Northern Light canceled talks early to give patients hoping to stay in network at Northern Light time to find other insurance options.
There are other providers in the community, and so it's important to give folks enough time and employers enough time to shift their care to another insurance provider.
Worried about Mainers, Senator Joe Baldacci of Bangor is pushing for a public briefing with the two companies this fall.
I think they need some sort of public pressure in order to restart the talks and to keep those talks moving to fruition.
Due to different plans and structures, patients are encouraged to reach out to Anthem Insurance to know how their specific health care coverage will be impacted. Christian Harsa, News Center, Maine.